All right, everyone. I'm going to bring this Health and Human Services Committee meeting to order. It is July 18th, 2023, 4:01 p.m.
93 degrees.
It's not gonna rain, so they say, right?
Yeah.
And we are going to begin with Department of Social Services.
We have an easy one today, only one. Does everyone know Michelle Blocker? Yes. All right. I don't think we've met in person.
Michelle, it's a pleasure. Can you? Because I didn't get that.
You Blocker.
You block. That's right. Actually, your reputation precedes you. You're-
I don't know if that's
You
good or
block.
bad.
No,
Yeah.
I've heard great things.
Right, so we just have an authorization to enter into an agreement with Anytime Home Care for the provision of independent medical reviews. This is related to our CDPAP program, and it is an unfunded mandate. So, and it's relatively new, so we don't generally know exactly how many we're going to have, but we're thinking 1 to 2 a month. So.
I'll move it.
I'll second. Further discussion? All in favor? Aye. Opposed? Carried.
Are they gonna be doing independent UAS assessments on these people?
I think that we already have something set up for UAS. So I'm not sure advertising specifically with this.
They should be given the state for the do.
Huh?
New York State do the assessor, then coming to other,
Oasis, okay.
the state do that.
The UASs?
Director Grandinetti, would you like to approach the bench?
Where were you?
I'll be short because I really want you to meet Lisa Galena and talk about our Think Different proposal. Just to give you a couple of updates. So the pickleball courts that we've been nominated to get through Senator Hinchy's office at a grant of $100,000 is a pretty big deal. And we're going to meet Thursday with Supervisor Collins and Director Mike West from the Chatham Park, right? So now it's just the application process and putting paperwork together. So hopefully we'll have 2 pickleball courts out in Cohen Park for at least maybe next season.
And the youth of Chatham are very grateful, but also the older demographics of Chatham are very grateful.
Yeah.
I don't know if you've spoken with the village mayor, but he's had an absolute kerfuffle over a set of tennis courts up on Jones Avenue where there's real tension. Threats of lawsuits if pickleball lines are painted on
Yeah,
tennis courts and
that's
things of that
already
nature.
there.
So,
So, but the jury's out on that. I've been reading the studies on that, and some people say there's no impact, and other people say there is an impact, that it's harder to read, but I noticed when I was traveling in North Carolina is that the surfaces have changed from green to blue, and it's easier to read on a blue surface than a green surface. I thought,
but we're going to try to do dedicated pickleball courts.
so that'll be tougher.
All right. Well, thank you very
Okay.
much.
So this, and it was the idea that, so the circus started last week at the town of Greenport. Went over and got a chance to take a look at it, to see if be well received. Today they're out in Pleasant Park.
Yeah.
So we're going to continue to follow that through. And I know they're working, Gallatin as well for the town.
Canaan for the town community day. That's all right.
Canaan's,
You knew it was me. That's
yes.
Wrong out of the county.
So as I introduced Lisa, I just want to give you an idea. So when I first came on board, Matt, Chairman Morrell charged me with trying to think differently, advance the idea, the concept here. So after speaking to Dana Hopkins, who oversees the program in Dutchess County, I quickly realized it was a pretty good sized program, a lot of dedicated staff to it, individually dedicated staff. And it was clearly a youth issue, a mental health issue, a family issue, and a educational component. So what we were able to do is we brought Dan Almasi on board, who is actually friends and colleagues with Dana Hopkins. So that's a big bonus. We have Bob Gibson from Social Service with the family. We brought Lisa in from the education component, and we have Supervisor Collins and Supervisor Claire Cousins, because we need some finances as well. So we were able to wrap a group together. And so anyway, we have a pretty good proposal. I'm going to introduce Lisa. She is the rock star in this arena, and we were pretty excited to get her on board. So I'll let Lisa do the rest of the talking, if that's okay.
Thank you, Dan. Hi, I'm Lisa Galina. I am the Executive Director for Cornell Cooperative Extension. I know some of you from our monthly and bi-monthly experiences, and thank you for having me here today. So we're just incredibly excited to be able to put this together and get the support from the various DANs and the commissioner, as well as people from other counties. So Cooperative Extension, our ultimate goal on earth is education, be that agriculture, the humanities, which is where this falls, is the life sciences and human sciences. So as you know, Cooperative Extension initially came through, just give you a brief history. Cooperative Extension was initially created through President Lincoln and the Morrill Act. And then after that, there's Smith-Weaver, which is the federal funding. Then it went to allow land grant universities to be created. And ours in New York State is Cornell, but we are our own subordinate government agency, 501(c), and all we do is education. So our charter would be disrupted if we do anything other than education. So everything we do is offering education. So why this is so interesting to me is throughout my career and in my personal life, I have known a lot of people who are, and we've changed our terminology over the years, Asperger's, the spectrum, neurodivergent, atypical. There's been so many terms, and they are often used rather interconnected. And in our county here, I believe that there's been a disconnect of like what are all the services and what can we offer. And I've lived in Dutchess County many years of my life, and I spent the other half of my life here because my father has been here for a very long time. And so with that, looking about services being in this position for a year, it's been kind of hard to figure out where are the holes. And it seems like a program that would be as comprehensive as Dutchess, we're not ready for that. We're ready for more of a community-based education program. So the concept is we start with the fair, and we do similarly to what Dutchess, Orange, and Ulster Cornell Cooperative Extensions are doing. We provide support to the educational day at the fair that is sensory friendly. For 3 years at the fair, we've been offering a sensory friendly area over in our ice cream 4-H area. And now we're going to, if this goes through, be able to purchase more durable items that children and families can come and use. And it's a quiet space. It's this pretty much about the size of this room, but it's a quiet space where families can kind of get away from all the noise at the fair. Also, the fair board themselves are working with Dana Hopkins on a sensory morning. So probably from like a 9 to 1, which is wonderful. And that would be a great way for us to share this and have people come over and into our space where that people can know always at the fair. This is the place. It's a former Clover Bud, moving Clover Buds into the Columbia Hall for the fair. So once a month, the idea would be this. Any adult who's interested and any parent can come to our program, which we'll host at our facility on Route 66. And people can bring children ages 5 to 12, or if their developmental age is at that level. Because some people who are on the spectrum developmentally might have a lower IQ or developmental ID that might be may have them more appropriate into the younger children programming. So we will offer a program where in one building I have two staff will be doing programs that are sensory friendly, educational, and in the other we'll have specialists in the field come and give us interactive presentations for parents and community members. Because for some people it might be, you know, supervisors, you may have family members or friends and you want to become more aware and informed on how to create an environment in the county. And for others, it might be it's your child, and if you're struggling and you want to know what resources are there. We've already have meetings set up with Anderson School, who I've worked with before, as well as with InFlight. And we've had a phenomenal collaboration already with Dana Hopkins from Dutchess County, who connects with Cornell. So that's kind of an overview, and I'm here for questions.
Said 5 to 12. I think the sheet says 5 to 10.
Sorry, it should be 12.
Oh,
I will update that and resend. We went back and forth on what is adolescence, what is, you know, New York State elementary school is 6th grade. So we figured that we would try to go to elementary school. We can't take on the adolescents yet. And so I'll come back for a much larger ask if we're going to go into the adolescent domain, which we would like to build on that and do that in the future. But we wanted to start off with something that would be able to be accessible and manageable for a smaller ask.
And for the October one, for business connections, it seems like it would be an older age group than
So-
5 to 12.
So the adults would be in that business connections and the children would be in another building and they would be learning about careers through experiential things like using toy trucks or building things. So they're learning at the same time, the same content, but just in a different delivery and,
Okay.
developmentally appropriate.
We have no problem putting 5-year-olds to work, right?
No.
I'm out there. You got a labor shortage.
It's building blocks,
Now, you say we would bill $1,800 in the first month. Are you looking specifically for county funding? Are you looking for outside funding?
So for this year, for the pilot, we're just looking at the county. And then if we have successes, like the metrics would be how many people attend, how many people come back to the next session, how many people get referred out to other services within the county. So then after that, then we would have more of a body of evidence to say, we're beginning to uncover what we have and what we don't have. And then the ask would be to look at other organizations who might have funding through, grants or things of that nature.
So about 10,000 or less would be in the 2023 budget and the balance would be in the 2024 budget.
Yes.
Is that something that DSS can support?
Bob thought that he would be able to find it and can support it. What he already has.
Existing.
Terrific. Does anyone have any questions for Lisa on this, or?
I do, I have a question. So it's a once-a-month program when the kids come in, they're 5 to 10. What is the expected, what is the follow-through month to month? You know what I mean? So the retention span.
So since we're educational based, ours would be publishing out our program calendar, and then one of our coordinators will reach out to people via email and phone call to see if they're coming to the next event. Also, it's going to be an environment where you could come for a couple of sessions and then miss a few and then come back in. So it's sort of this to gather the data to see what the need is. So you don't have to come to every session. People can come to every session. You can come for the ones that interest you only. And that's going to help us to gather the data on what, if we build out for a larger grant ask or research, we'll know what we're looking for.
No, that's not what I meant.
Oh, I'm
I meant
sorry.
the follow-through for the child
Oh.
that's coming in. Where's that follow-through? If it's a monthly,
So we are not therapists, we are not counselors. That's why I started with that whole educational spiel for you. I think so. If there's families that come, what we're hoping to do, like by meeting with InFlight, meeting with Anderson, meeting with the other organizations that already exist in the county, by doing that to figure out where can people be connected and referred to. Is it early intervention services? Is it a social skills program? And then that further, because we can't provide that, but we can try to, and in this initial research, we tried to find out what exactly is happening. And it was a little bit hard to get information back, but we already have a meeting with InFlight and we have a meeting with Anderson. And they would be your providing the therapeutic intervention or social skills program.
So you're gonna help direct those children to where they need to.
Yeah, and that will help build stronger relationship with Extension and the county to know which department is this young person going to go to one of Dan's specific programs as a result of this, it's ongoing, as well as, early intervention, or if our educators see that they have a speech delay, who is there, where would you go for that? And then that will give us a better kind of network to understand. Because I think we're not all aware of everything that's there. And I think we're also not aware of what's missing. So that's why it was built on this monthly model.
okay, thanks.
So are
You
these-
answered that well.
So are these children that are already diagnosed?
They can be children who are diagnosed, and they can be children who the parents are wondering, why is this young person perseverating on the spinning fan? Why are they upset about noise? And they can come and have that experience and learn. And then we can connect them, we can refer them back to the proper county department or their school district. So we're not going to ask for anyone's diagnostic information, but so there's children that have cerebral palsy that present like they're on the spectrum. And there's children who don't get diagnosed on the spectrum until they're in their teens. And there's all of us who will think we know people who, 30 or 40 years ago, they probably would have received a clinical diagnosis if the language was used different. So we're trying to really not exclude anyone.
I just didn't see, I was struggling with this because I didn't see any specific curricular or topic that dealt with how to know if my child may need these services.
So that's where it would be partnering. So we have, the people that I have in mind to join us are clinicians, educators in the field that work specifically with people who are on the spectrum. We have speech pathologists who will work with us and do one session pro bono. And then we have other people like from Anderson School who can come out and do an education, but it has to really, if it's an early intervention, that's the universal system. But if it's an older child, then we would need to refer them back to their school district to go through the proper channels.
Is there an FAQ or something that could maybe print, that would be a handout that we
We
could?
could, and who the right contacts would be.
How to find.
Yeah, contacts. Or, because I think a lot of the times the early intervention, people kind of know where to go, but it's kids who are, it's later on where you're not clear, like what's happening, is this a behavior? We had a lot of conversations when we were there, supervisor was like, is the behavioral problem happening because the diagnosis on the spectrum didn't happen? So what's happening is not in the best interest of moving that child experience forward. So that's a great idea. And that's something that we could create by our first event that we'll have in October. And for the fair, if I can gather as much from anyone on that. So the thing is, I didn't want it to be titles of people, because people, as we know, move around. So that's who in your school district do you go to? We know who that is. Who in the county do you go to? And so to build, so I could definitely have something like that together for the fair, just like organizations and agencies.
Well, you also have outreach materials for like each town and maybe put up digitally or physically
Mhm.
in town hall sites advertising your
Yes.
fair and your programs there.
Yes.
That was one of my other questions, whether there was a number in here for promotion.
So that's included. So that's for us to do social media on the different platforms that we put our stuff out on, also put it on our own external facing website. Facebook and Instagram are the two channels that we use. So it would go on those. And also we would have one of our educators can go out and put them in physical spaces, because I think that's important too, in the community centers or town halls. And that can be something, we do it for the fall and then we go do it in January for the spring.
Yeah, and most of the towns, I can't speak for everyone, but we'd have stuff posted on our website on your behalf.
Oh, great. And so
So,
we could go through the
yeah.
town's websites. Yeah.
Lisa, may I say something?
Yes.
I think as I'm listening, I think what Kurt is touching on is really the magnitude of this topic. It's, title Think Differently, but really, I see it a little differently in terms of it's what is our community proficiency with this population? And as Lisa said, over the past several years, the terms, the language, the lingo has all kind of changed and it's been interchanged and all that. But in general, this is a big topic that we're talking about, and trying to take reasonable bites at it can even seem overwhelming. But, even the providers themselves, for example, at the clinic, we are the Columbia County Mental Health Center, yet depending on how that clinician was trained, what their background is, where they interned, how they studied, they may or may not be as proficient as one would think with regard to spectrum disorders. So there's a need and a level of increased awareness and proficiency, even amongst the behavioral health professionals, not to mention the schools, not to mention the general public. So I don't want to make it sound daunting, but it's a pretty big task. So I'm excited that we're taking these infant type steps in the right direction. And I think, year after year, we'll confidently be able to grow and move in all these sorts of other more sizable type efforts. But right now, I think this is, the group, not just me, but the group felt, let's learn how to crawl with this before we walk and run. And that's what I think we're trying to do.
And Dan, thank you. So I thank you for mentioning, because that is one of the challenges, that depending on when you went to school and when you're trained and what your focus is as a clinician, you may or may not be as up to current, standards. And then also, really one of the things I think about, and we talked a lot about this in the meetings we've had, Dan's like, we want to be a more welcoming people, right? So everyone often does these trainings and think back to trainings, and it's always like, how do we make supervisors fit into these? How do we make people fit into this, but instead, how do we make people more kind of open and accepting to learning about differences in people's thoughts or behaviors, and not that it's, oh, this person, if you think about kids making fun of someone with Tourette's or a tic, or they have a physical disability. So we've come pretty far from like people don't do as much physical disability othering and making people feel that, but they do it a lot with people on the spectrum. So we want to, how do we get folks to think about their, you know, your restaurant, your employment, the fair, right? So we know it's just the fair thing is such a great way to think about it. If you're an owner of a business or offering a program, how do you offer it sometimes where, and I think the theater in Chatham offered a film night that was a sensory, and that would be something else we would want to try to do, you know, in the future, because the creating space for people to feel comfortable to go, they're more engaged in our community. They spend the money here, they stay here. And the other thing is, which I'm not driven by like for money, I'm driven by the education, but the money point is the fairs that do these draw people from all over. And like people go to Dutchess County Fair because they've been doing this for a number of years now, from Brooklyn, from everywhere, because they feel like this is finally a place I can bring my family members, be they children or adults, where it can be an experience that's enjoyable.
I think there's also the ground has changed because we had 2 years of COVID when kids weren't socialized and weren't going to daycare. So delays
Yeah.
or behavioral differences may or may not be something that parents should be concerned about based on that change in their environment.
And
early
also
environment.
with children who are homeschooled by parents who may think, you know, it's hard when they're homeschooling sometimes to differentiate, is this the parent-child dynamic as an educator, or is this a overall situation that's happening because of those years that lapsed? So I think there's so much. That's why we wanted to, as both of the Jan said, we wanted to not try to take on too much so that we could gather information and then figure out and come back next year and say, okay, here's what we think from this that we should try to approach doing.
Do we need a motion?
No, I don't think so. What I just wanted to add is that 5 or 6 years ago, we passed a resolution as a board of supervisors declaring ourselves a Think Differently County, and not a lot occurred. So I just want to thank Dan
Yep.
and Lisa and Dan and Bob Gibson for sort of taking the ball and running with this. And, you know, when Dan got hired, I sort of met with him and said, this is one of a couple of items that was sort of on my list that, you know, I'd like to see get going. So I appreciate you guys moving with this.
And we do have a link on the main website to Think Differently. It's kind of outdated. So if you have information you want to put on there,
We just
Yeah,
got
that's-
added to the Duchess one, so I want to not immediately cannibalize them and ask them to get on theirs, but they have amazing resources, so
Right.
it's not reinvent the wheel, but ask them how we
Cut
can.
and paste is such an expedient.
yeah.
It is,
Like-
it's not interesting.
We don't worry about intellectual property around.
Yeah, and I think what's worth mentioning too is Dutchess County had put on a training for like all emergency responders. So the committee, us, were talking about doing something similar in our county as well. And I know that we've reached out to PJ and the sheriff and what other emergency responders out there. And so I think the committee's interested in putting that on as well, separate from this
Yeah,
proposal.
and we could, hopefully one of the people that we work with might be able to be one of the educators for that, which could be.
To give credit where credit's due, back 5 or 6 years ago, a former supervisor, Jeff Nair, brought this to the county. So.
Well, thanks for your background.
Thank you. Thank you, guys.
Thank you, Dan and Lisa and
Yes,
the work
yes,
group,
yes.
Director Almasi.
Let me know what I can do.
Bob Gibson. All righty then, Director McDonald. Office of the Agent.
I'll take the place of social services. They only had one resolution. Unfortunately, I got 5. Okay, first,
Second.
Further discussion of what? All in favor? Aye. Opposed? Carried.
I'll move that one too.
Second.
Further discussion? All in favor? Aye.
This is going great.
Opposed?
Pretty easy, huh?
Carried.
okay, third one is,
Yeah, he gets a word in.
Hold on. Yeah, go ahead, talk about this.
Yeah, permission to contract with a consultant to assist in establishing a family caregiver support program. The state is making us come up with a program. I shouldn't say making us, but they're,
They are, they
to
are.
come up with a program. They came out with this late last year that, and it's true, they're saying that there are a lot of people, unfortunately, in a situation where they're providing family caregiver support services to someone. And quite often that person needs more services than the person who's receiving the care. They've come up with we have to come up with a program. They've given us some guidelines. And, like I said, we have an experienced person in mind that we'd like to bring back on board, that being Michelle Cram, to help with that. Michelle's been working with the state as far as this caregiver support program. And like I said, she would also help with, and again, I apologize for not introducing Kate West, who was recently hired to fill Michelle's position. I brought her along today just to meet the folks.
Thank you, Kate.
And, but anyway, like I said, it's just a program that it's probably long overdue. This actually came about back in the early 2000s with the programs from the federal government.
I'll move this one for you too, Kevin.
Second.
Further discussion? You didn't even give her a chance to go to Poconos for her retirement. Get her back on the roster.
There you go.
Well, this program's gonna start very soon, so,
Yeah.
yeah.
Hopefully she had 2 weeks.
All in favor?
Aye.
Opposed? Carried.
Okay, the next one's just to move some money around, get a check from insurance company regarding a motor vehicle accident that one of our vans were involved in. And they're, we got a check for almost $5,000.
I'll move it.
I'll second. Oh, God.
Does that
Further
cover,
discussion?
does that cover the cost of the repair?
Yes.
All in favor?
Aye.
Opposed?
Unfortunately, it didn't
Carried.
cover the cost of 2 months being without it, but we've had to use cars for some of the.
MIPA, here we go.
MIPA, that's
We got MIPA now.
Medicare Improvement for Patients and Providers Act. Basically what they do is they're going to provide education and counseling to people as far as, I'm sure a lot of people know how difficult it is to navigate the Medicare system. And they're going to provide outreach services to people and kind of educate them as to how they go about applying for it and so forth.
That's
I'll
a
move
year, $3,000 a
Second.
year?
Yeah.
Yeah, okay. I'll second. Yeah, okay.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you, folks.
Thank you.
And your report.
Well, you got those 5 resolutions done in less than a minute.
Your report.
Oh, yeah, okay, forgot about that monthly report. I don't know if everybody should have got a copy of that.
Yeah.
If anybody had any questions, I've got it here someplace.
On the screen.
Some screen.
Can't see that far. Yeah, like I said, the wait list isn't really a wait list. They're people that have been in and out, and we haven't been able to establish a regular program with them yet. But again, that's why both of our aides they're booked solid, and like I said, they are going to be taking vacation time and stuff like that. That's why we wanted to hire another per diem to bring on, if we can find one, to bring on board to fill in the gaps. People don't have to go without.
How are we doing with Everhome this month?
They're about the same. We picked up maybe 3 or 4 new cases. It's a very slow process, and I think we've lost 1 or 2 also. But we're plugging along with it. I'm sure that the 35, 40 people that have it are very appreciative of it. It's helped them a lot. And again, getting back to the caregiver support program, it's out there, and there's a need for it. I'm sure there are a lot of people right here within the county that are experiencing difficulties with family members who need support services.
So I had a call yesterday from someone that has a long-term disability, not a permanent disability, but a long-term disability. You think they would be eligible for the pilot program?
Sure, sure.
I put them in contact with Linda. She's gonna be back on the 20th.
Yes, she'll be back, yeah.
Okay.
Good, no, that's, I think that's just what they're looking for.
Okay.
Those kind of referrals.
And I did see when I went to the website that it says first 50 cases,
Right,
right? So if we're at 40, are we nearing the end of our window?
probably as far as the free, unless, now, again, this pilot program is technically timed to end at the end of September. I had a meeting with those folks on Monday morning. I know they want to extend it. There's no doubt about that. And we're working with the state to make sure that that $100,000 that they gave us is still going to be available. I'm quite sure it will be. I can't say publicly that it will, but I'm quite sure it'll be still. We haven't even used quarter or a third of it. And like I said, I'm just looking for something in writing for them saying that they want to extend the program.
But that's two different things, right? The first is whatever the community group was that gave us the first 50 patients.
Right.
And then the second was the additional funding from the state to support Columbia County Services.
Right.
Okay.
And then in addition to that, they're
And I know-
passing
and
out
I-
free hardware, right, to other.
Yeah.
That's
And
the first
and I know they've also reached out to that or other organization for additional funding. I don't know if they've gotten a response back yet. Hopefully Monday I'll find all that out. I'll be able to bring something to the next committee meeting.
And that state money, for the most part, you've spent on, I forget.
Just on the consultants, basically, you
Yeah.
know, and a lot of
Some
travel,
Some
and
marketing, right?
marketing programs. So.
Okay. Any questions for Director McDonald? Thank you, sir.
Thank you.
All right, coming up next, we have Director Almasi from Mental Health.
Hello, everybody. Good afternoon.
The Dan.
The Dan, the second Dan, the other Dan, the other Dan.
Or the first Dan.
Well, no offense taken either way.
One of the Dans.
So I have a total of 4 resolutions. I guess I'll start with the financial resolution first. The financial resolution is to request an adjustment to the 2023 budget with regard to a cost of living allowance in regard to Twin County Recovery Services. So it's this is money that came to us that we're going to be passing on to Twin County. So we're just asking that there be an adjustment.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Next would be one personnel resolution. We've had a resignation of a clinical staff person that carries the title psychiatric social worker. These are titles that we're looking to abolish. So I'd like to create and fill with the lesser grade title, which is behavioral health social worker or senior behavioral health social worker.
Move it.
Second.
Further discussion? All in favor?
Thank
Opposed?
you.
Carried.
And then the last two are similar but different in that the general resolutions. One is an authorization to contract with for a psychiatric nurse practitioner. Now, keep in mind the county has that title, but this individual has wanted to come on board for 21 hours a week. So she is asked to contract with us as opposed to become an employee. Given how difficult and challenging it is to find nurse practitioner candidates and the fact that I need the prescriber hours at this point, I went ahead, I spoke with UPSCU and they were very agreeable to allowing me to do this. So I have UPSCU support to contract for what would be a civil service union position, basically. So the MOU, as I understand it, will be coming, but I spoke to Michael Reed and she suggested that I go ahead with, presenting the resolution here to all of you today.
Can you tell me, Dan, what is the conflict of being an employee? Why do they need to be a contracted
Well,
individual, or is there nobody else to do this job?
the civil service position as it stands is a 35-hour-a-week position.
Yeah.
And she has agreed to work part-time for another private practitioner, and she wants to round out the rest of her work week with us at 21 hours a week. So,
And there's nobody else applying for this. I take it that you've already been down that path, or?
well, I don't want to muddy the waters, but
Okay.
yes, as of today, interestingly, because so you may remember that a Novotel is a fully remote, video-based provider that we're contracting with. Unfortunately, I just got word that the individual that's providing that service to our clinic for a Novotel is leaving. So then that leaves us having to go to a Novotel and say, hey, please provide us another nurse practitioner, which they will do. However, I amazingly just received 2 resumes for nurse practitioners, which I say amazingly because it's been no resumes for almost 2 years for the nurse practitioner position. So it's surprising that these happen to land in my inbox.
Okay.
One of them is from Stony Brook, New Jersey. So I need to verify that individual is interested in relocating. Sometimes we get these resumes and they don't understand where they're applying. The other person is coming to us through a recruiter, and they are based in Albany and very aware of where we are and very interested. I have a phone call with that person Thursday afternoon. And so we'll see what happens there, but it's kind of 2 separate things in that the Novotel worker that's leaving will either be replaced by a Novotel. That's 35 hours a week. So I definitely need to replace that with either a Novotel worker or one of these individuals that's presented a resume most recently. However, my capacity for prescribers, they're at maximum capacity as it is. So that's why I need to bring on this individual for the additional 21 hours. Any questions about that?
Would you
Okay.
ultimately replace this person with a full-time person if a full-time person became available, or is it 21 hours sufficient?
At the moment, it's sufficient. It's tricky because we have been poised on multiple occasions to launch open access. That's the walk-in clinic. If we are successful, and I'm hoping that we will be in the very near future. I know I've said this here previously, and we've had to dial it back because people have resigned, and then we have to absorb the caseload of that individual, which puts us a few clicks back in terms of open access. But if we're able to do that, then yes, there will be an influx of individuals who will be admitted to the clinic that will then translate into individuals that need medications and need to be seen. So maybe the 21 hours that I'm getting out of this candidate will not be adequate. So I don't know if I would dissolve their contract or just try to find somebody to
Pick up the
round
difference.
out the difference.
Okay.
You know, she is a former student. She was a student with us and was very, very proficient. So we have a really good candidate here. And that's not always the case where you have familiarity with a candidate coming in like that.
You need someone to move it?
Yes,
Has it
please.
been moved? Is it okay to move it? I'll move it.
Do I have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
So similarly, but slightly different, we have one of our nurses in the, what is the title actually? Mental health psychiatric nurse title. And that individual has told me that he would like to, wind down, meaning he doesn't want to fully retire, but he wants to retire from his position and come on less hours, 21 hours. Again, I've discussed this with the union. They understand the nuances of it because in this case, this particular nurse is responsible for administering a medication called Clozaril. That's an antipsychotic medication. There's a little bit involved in that. He's also very familiar, he has the historical knowledge of the department, our practices, our procedures, etc.
I'll move it.
So thank you. To lose him and take my chances
Thank you.
hiring somebody would be a challenge I'd like to avoid.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Okay. And then the last thing is I'd like to ask that we go into executive session for a brief conversation on a matter related to the Department of Human Services and the after hours on call. I'd like to bring something to your attention so that you're aware. Elements of it have not yet been finalized. I'm in conversations with the help of Michael Reardon, myself, and Mr. Kutsky from UPSCU. But
Is this a personnel matter then?
well, I don't want to get too far ahead until we go into
It's a
executive.
contractual.
Contractual, okay.
I'll move it.
Second.
All in favor?
Aye.
Second.
All in favor?
Aye.
So, thank you, Supervisor.
So we're recording just. so
God bless
everyone
you.
knows.
Come on.
Well, could be, public safety.
Yeah.
Yep.
The gallery.
So we were done.
Oh,
Yeah, no.
Should we see if our public
We're
return?
recording.
Recording, Phil and, so.
All right.
Okay, any questions from the public or comments? There being
Did we do the
none?
board?
Oh, Wait a minute.
Did we do board of health?
They're not here.
They're not there.
All that has is a report.
You got the
Just
report?
reading it. Okay.
All right.
Any questions from the public? Okay, that being said, I'm gonna ask for a motion to adjourn.
I'll make that motion. Second.
All in favor?
Aye.
Opposed? Good night, everyone. Thank you.
Everybody, I'd like to call the July Public Safety Committee meeting to order, please. First department up is District Attorney.
Hello, so we're here, I'm not the DA, as you all know, I'm just Ryan, probably one of the ADAs, but we're here, we're requesting for a change to fill 2 full-time ADA positions. It's budget neutral, we're gonna to new ADAs as of right now. They are taking the bar next week. Hopefully, once they both pass, that'll result in another amendment to bump their salary as a result of once they're actually admitted as attorneys. But as of right now, we're just trying to fill the position, the 2 ADAs, which we have vacant, with soon to be full-time attorneys.
I'll move it.
Second. All in favor?
Aye.
Opposed? So carried. That it?
That's it from the DA's office.
Thank you.
very much.
Thanks, sir.
Oh, hey, Brian. Is that the DA's?
Yeah. 911?
Good evening, everyone.
Hi there.
Good evening. I have a resolution request to fill an emergency dispatcher position due to an upcoming retirement. Position is budgeted, starting salary of $55,188.02. Requesting an emergency fill.
Move it. Second. All in favor? Opposed? So carried.
And agency data for June of 2023, our call volume for June was 4,316 incoming calls. We dispatched 1,360 EMS agencies, 380 fire agencies, and 2,284 police polls with 488 public service calls. That's a lot.
Questions? Thank you.
Thank you.
Thanks.
Thank you.
Emergency management?
We submitted our report. We have no resolutions requested, and seems like it was a good time to be away.
Or a bad time to come back.
Yeah. So, I'll answer the questions.
Questions? Thank you, sir. Fire.
Yeah, not much either, just the agency data, just the response for the last 30 days. Training for 30 hours, but if anybody's got any questions, I'll be more than happy to stumble through them.
Still cleaning up from the storm.
Yeah.
Pretty much everything. I mean, it gets close stuff.
Yes, I mean, most everything's open pretty fast, so. There'll be months up on non-generous. That'll be probably the next one before they get.
Right, yeah. How are we doing for recruits, George?
We're actually doing another survey this month, July, sending it out. Some companies have been doing well, others not so good, but it's still up and down, just the same cycle that it seems to always happen.
Just hasn't gotten any better, but.
No, but, some areas they've been doing a good job and, it's just, yeah. Okay. Be able to pull some in.
Have you started the student program?
The student program will not start until 2024.
Okay.
They'll approve it this fall at their board meeting, and then they'll start the high school students September 24th.
Okay.
Any other questions? Thank you, George.
Thank you. Thank you, George.
EMS?
Okay, nothing to talk about.
First of all, just to let you know, we received notifications on June 16th from UCM Digital, which is our telehealth provider, that the squads have started to use and 911 uses also, that they are discontinuing their contract. They gave a 60-day notice that they're pulling out of the whole area for that type of service. Read between the lines and speculate, but basically they did their legal duty by notifying us of 60 days that they're discontinuing service. So their use at the 911 center was minimal. My understanding is that most of the telehealth services throughout the region for this particular agency were kind of minimal as well. We use them for very, very low acuity calls and trying to transition them over to telehealth. The last number that I remember talking to Kevin about was that we had about a 30% conversion rate. We used them when our system was very busy and somebody would call up and say, you know, my right pinky has been hurting for like a month and I want an ambulance. We try to convert them to telehealth. So the transition to telehealth was minimal at best. So 911 agencies around the area, I believe, Rob, are looking at another company. Is that correct?
Correct.
So trying to standardize amongst all of you. Okay. Good.
Well, how did the pay work? Is it a flat fee or is it paid per call?
The telehealth?
Yeah.
Telehealth services would be paid by the person that uses it.
Okay.
Yeah.
So their insurance.
Just like an insurance.
Okay.
I went to a doctor. Yep. So, any questions on that? Okay, the Fitch report. Obviously, as a board, you received the report. We went to the agencies the following night. Supervisor Collins was there. Supervisor Adams was there also. The 45-minute presentation that he did here took about 2 hours there, which was good. Went into very lengthy detail. He explained a lot of issues. The report that you did receive was kind of a condensed version. The full draft report that's in process right now is like 80 pages long. So it's very detailed, it's very condensed, but they're out there trying to get some feedback and some input. I have requested a couple of additional add-ons to the report as well, where they came back and said the most efficient from a cost standpoint would be to have 4 geographical locations versus the 6 that we have now. But that would give us a 15-minute response time anywhere, most places in the county. I asked them to come back with a 5 location, so we have something to at least look at and compare to. So that's where we're at. There was not a lot of general discussion, and supervisors chime in here if I need to be corrected, but there wasn't a lot of general discussion amongst the squads. I think they were just kind of hit with the information. It was an original hit. There were some people there from some of the boards of directors, which was a good thing. So we're kind of letting that sit, let them take it back, digest it, see what happens, and then take the situation and work at it from there. I do
Did
believe.
Kopek speak up? Did Kopek?
Oh,
speak
yes.
up? Oh, yes.
Your man that you introduced
Yes,
me, yeah,
yes,
he was
yes,
there.
yes.
But I think he was genuinely taken in by the information and the factual information. So, but again, all the input is good. I truly believe that, you know, the system that we put in place 13 years ago, whereby we have this county CON, this overlap, that we will be able to leverage that and use that to try to correct and move EMS forward as we move along. It does provide and it will provide a safety net for anybody that does not meet some of the baseline guidelines. I think we need to beef up our contract with the agencies by putting in some of the benchmarks that are not there currently. There are a lot of issues that we are not reaching individually as agencies in regard to patient care, operations, so on and so forth, that we could build into some of these contracts and work our way along. By using Columbia County EMS system as it is, would not prevent mergers or anything else. One of the things that was identified in this, and sure that you do recognize this, was an accountability factor. I truly believe that we as a county and as you as towns deserve, and we have the right to the access to the financial information. If we are supporting these agencies to the tune of $3.5 million, that could be set up through our CCEMS or EMS advisory board, or whatever way we restructure it, so that there's accountability back to you as a town and we as a county for full detailed financial information that was truly identified. And I think that's been a bone of contention all the way through. The other issue is obviously the operational support and the operations themselves, that there needs to be more coordinated activities that takes place throughout the county. And again, we have the structure in place to be able to do that. We just need to have the ability and the insight to address these issues. This Fitch report has brought out the issues, what the issues are. So again, there will be another draft that'll be coming through in another 2 weeks or so. I will forward that on, and I look forward to continued discussions.
Those two agencies that didn't cooperate, they didn't give their financials, can that be rectified before the next draft?
No. My information that they told me is that they received financial information in different formats from different agencies in different ways, bits and pieces.
But
The
they said,
only-
he said the other day, there were two that didn't cooperate. He didn't use the word cooperate. He said there were two that didn't give financials.
Right. Some of them, he didn't get financial, like a profit and loss statement. However, he received a tax return. NDP is the only one that provided no financial information whatsoever.
Was somebody ran the NDP there?
Yes.
And
Yes.
what was their initial response, or was there none?
They asked Todd from Fitch to contact some of their owners the following day. So I did follow up, and he sent an email, but
So firstly, Fitch did a great job. So that's, and this all sounds wonderful, but if we don't have cooperation and from other agencies, how is this going to work? I mean, you say we should do this, we should do that, we should do this. How do we, with a heavy hand, how do you force this to happen other than through threats to say towns are not going to, contract with you? But so, this all sounds great, in theory, and I think I like the direction we're heading in, but realistically, if you have agencies that are not willing participants, how are we going to do this?
I think they will be willing participants. There may be one that's not. I think that what we need.
The one is large, if they're not.
No.
No? Okay.
This is the one that gave no financial information whatsoever. Okay?
That's what I'm saying, but they're pretty, they take on a pretty big area, don't they?
Yes, they do.
One bus.
One ambulance, okay?
Okay.
One of the recommendations that you saw was address it. Either towns don't support them, or.
But that's easier said than done. I mean, for towns not to support, I know we're gonna have a lot more conversation on this, and I understand that.
We can't resolve this here tonight.
Correct, but I guess I'm just trying to wrap my head around this. It's not so easy for towns not to contract with an agency. It takes time, it's a lot of work, it's a lot of. So I guess, what's the next steps?
Next steps are, again, get the reevaluation back and some of the input, look at the 5 geographic locations, look at the financial aspect of that, the projected financial aspect of that, sit down as a group and try to decide, how do we address these issues? My thing is that I think we have the structure in place to implement this. Right now, we send a contract to all these agencies. The only thing it addresses is our ability to relocate them when the adjoining area is out of service, okay? That contract needs to be expanded. There needs to be metrics put in place in that contract that addresses some of these other issues. And there needs to be accountability. That would be one of the things put in the contract, where there needs to be detailed financial information put back. You as a town, but then we could still use the chargeback system. But again, that would come back to the county, all right, after their budgets are approved and we have a total. The other thing we can do is, and these are all possibilities, is that the state did not pass the ability to tax as an EMS district.
Right.
However, it came close, okay? So I think it will go through at some point, but in the meantime, we could go back and figure out the cost per thousand of assessed taxable value in each town. So let's just say the total support we need to give these EMS agencies is 3.5 million. You can then divide that out according to the percentage in each town so that the cost is, pick a number here, 32 cents, 31 cents, 35 cents per thousand for everybody. Right now, there's a range in there that goes from 61 cents to 9 cents. Okay? So to raise about $96,000, if you raised everybody from 32 cents to 33, you'd raise $96,000 for the system. And I think that's a way we can deal with it and structure it through this organization that we have in place now.
And Fitch, we paid, if I recall, somewhere in the $40,000 or $50,000, correct?
I think it was, yeah, let's look it up.
Right, so, what is their obligation at this point going forward? Are they still part of what we pay them contractually? Is that for them to help us through this process? Are they kind of done at this point?
Their contract is to give us the report.
So they're done.
After that, they're done. And obviously, they're available on a consulting basis moving forward.
I think there's a path forward, but something you said, when you said that when everybody got in the room and they heard it, maybe they kind of, oh, we can agree with that, or we can agree with that. I think if the path forward is to get those people back in a room on a regular basis and hearing you, maybe not Fitch, maybe it's hearing from PJ. I agree that it can't come from the top, from the towns telling them what to do. I mean, these people have a lot of pride and a lot of sense of identity. And Copac, for instance, has a long history of volunteerism that grew into this. I don't see Copac, I don't see the town of Copac telling Community Rescue Squad what to do. But I think there is an opportunity for growth or change or evolution on the part of the people, because they're good people in that Community Rescue Squad. Sure. And you know, with the right, it's going to be a process. Not going to happen quick. And I don't see it going to 4. I heard about that. The idea going to 4. I mean, why would you go from 15? Go to 15 minutes when it's 13. Right now, it's 13 minutes, and they're proud of that. So they're not. Yeah.
Right. It's money. But again, this is going to be a work in progress. And I agree with you that I think it's important. This group developed the system as it was, okay, as it is today. And again, you heard the presentation. The system is not broke, okay, as it is today. But we can't continue down the path the way it is without some changes that need to be made. And I think this group heard that loud and clear. And I think there needs to be an allocation for parochialism in each agency. But again, this system, the structure that we have in place will allow for things to change moving forward because they can collapse into the system and changes need to be made.
So I think
10
you
years
have
from now.
credibility with them, and I think that there is a path forward.
I'm hoping.
Yeah.
I'm hoping.
Yeah. I still don't get how somebody doesn't turn up with their financials. In order to get support from the town, they had to go to the town with their financials, right?
I don't know.
I mean, a
Not
Community
necessarily.
Rescue
A lot of
Squad.
them don't.
Community Rescue Squad, we go there, we sit down, and Russ Davis goes through line by line. We know about every penny.
Yeah, but that's not the case
It's
with
not the
every
case.
rescue squad. Right? We had our own issues with our situation. I don't, we can get into a very long, lengthy discussion on all of this. So that's why I like the direction. I'm just hopeful that we can get there.
And I think,
but knowing some of the players and where we've been, it's I think a rather large task that we need to take on.
Yeah,
that's all. So,
and from my perspective, I think that the cooperation from the Board of Supervisors and you as individual supervisors need to apply that pressure to just say, we support this direction and this is the way we need to go. You don't have to exactly tell them or clobber them, okay?
Yeah.
But I think in that meeting, correct me if I'm wrong, I think they realized that, they're not going to survive you know, at the rate that they're going
Yeah,
today.
but some of them might cling to that individual.
Well, you know what? If we build the metrics into the system and into the contract, and if they don't meet the metrics, then you no longer support them. All right, that's the clout. Okay, and
There's
these
also the-
metrics are important because they're patient care metrics.
There's also the carrot though, because like Columbia, for our rescue squad, it's hard for them to keep up with the salary that people are demanding now.
Yeah.
Whereas if it was a broader umbrella system,
Right.
maybe there would be benefits there that we can't begin to offer.
That's correct.
So there is that,
Yes.
which I think will encourage cooperation.
Yes.
PJ, if one entity doesn't decide to join what we're trying to do here and it all works out, they still get supported by EMS and everything like that? Or how would that work? Or they wouldn't be?
That'd be up to you as a town.
Okay.
I mean, it's hard to pick. I'm not gonna name individual.
No, I'm just asking
organizations,
in
but
generality.
Well, I have to tell you, when we started the system, there was one agency that didn't come on for like 7 years. And they finally came on board.
Right.
We can't make them all fall into this, but however, if you as towns say, we're gonna send our money to the county,
Mhm.
and if you sign up with this contract and all these metrics, okay, then you'll get our money. If not,
You know, okay.
we may go to somebody else.
Yep.
There's options.
I'm sorry to say, the state has to happen.
Huh?
States
But
have-
again, there needs to be steps. They need to be involved. That's important, that they're included in the decision-making and how this moves forward. But my initial reaction and the response I've gotten back from some of these is like, yeah, we need to change. We need to make this work. So let's see what happens. If you support it, we'll move in this direction.
Any other questions?
Thank you.
Okay.
Thank you very much. So the last item on the agenda is bus patrol. Michael Chimides sat next to me with a rather extensive overview of what this, and I'm just gonna sort of go over what we learned. I'm by no means against it. I guess I'm not sure where I stand, but it may sound more negative than I really am, just because there was a lot involved to take this on. So Bus Patrol was here. They were terrific. They gave us a very good presentation, but this is a very large undertaking. It's not something we can do in a month. It's not something we can do in 6 months. This is realistically a year project in order to get this to work. The school districts in Columbia County are all for it. Bus Patrol would be one of the companies that we could potentially use, but in order for us to do that, they would have to do an analysis of what they anticipated it would cost to do this. It doesn't necessarily mean that it would be free to the county, because if they don't bring in enough revenue to offset their expenses, then the contract could involve a cost. We don't know that yet. We have to get judges on board for this to enforce. We have to get the state DOT involved to do signage, and there's a very specific verbiage on signage. Our county has to get involved with that. Obviously, we have to pass a countywide law. So it's probably a year project to get this, up and running. They did send us some of the compliance records, and I didn't really go through them. Did you, Michael? Did you go through them in detail? So I just think our heads were spinning, thinking that this is something they just come in, they throw these cameras in all these school districts, and it's up and running. It's not that easy. So they said best case scenario was 6 to 8 months. That's if everybody's on board and all the moving parts participate in an expeditious way, which, that's going to take time. The positive of it was that they will basically walk us through the process. They will be the ones to try to put all the little pieces together to get this to work. So, we wanted to bring it back to the committee to see, take your temperatures and see if this is still of any interest to the committee to go down this road. As I said, because I asked the question, I said, who's going to do this, take this all on? And again, they said that they would. So I see this as if this committee's interested, that it really would not take place until next school year, not this school year.
September 24th.
Yeah. So, and there's also, sorry, Matt, just one more thing, because I'm trying to remember. It may also not be, the legislature may not reinstate this law again, if I recall. So we don't know that where we're at with that, but anyway, go ahead, Matt.
I was just going to say, would it be beneficial to put together like a small subcommittee of 3 or 4 supervisors and maybe some staff people to work on this? Sort of shepherd this through or not shepherd it through, depending on what's decided.
I just don't know how everybody feels in the committee. Again, this is a pretty.
Yeah, I think you gave a good summary.
Yeah.
I think to tie what you said together is that it's not just about us putting a subcommittee together and passing a law.
Right.
It would be a year-long commitment to oversee a lot of moving parts. This would be way more complicated than us making a one-time decision.
Yeah.
So it's implementing something across several agencies that we don't have oversight over.
Sheriff's Department would have to have, or somebody would have to be overseeing the ticket process.
So I'm sorry I missed the presentation. I don't know how that happened, but I did. So anyway, I looked at the PowerPoint this afternoon. So I didn't see, maybe it was there. Is there data to show that it works?
We received some data. I think it's sort of, because again, these individuals can get ticketed.
Right.
There's no real enforcement for it.
I'm just saying, so you're a judge, how do you guys feel it? Will it work? Because if you don't get the enforcement at the end, that's where you're not getting.
Well, here's an example of
That's the biggest
all the
problem.
counties that are doing it now, and 2 of our bordering counties are begging us to do it because it's a process that they've adopted. There is
Overlapping school districts.
Right, and there is collection process that they handle for collection of fines, and that's what he said in the presentation. So
It was interesting because they were upbeat on this in some sense, but also a little flat, I thought, because the process is long. And again, the collection aspect is a little bit challenging. The county would have to figure out who would be the ones that would be shepherding this. Also, that's another moving part. We have to speak to the DA's office and see how they would, deal with it with the local courts.
Yeah.
So it's.
So like I'm asking for data and I don't even know what the data would be. So I'm thinking though that Copac has, now we have, I think 6 of those speed signs that say, thank you, or slow down.
Slow down.
You get scolded. And do those deter? I think maybe they do.
I mean, I think data shows that
Now, you
they're a
could never
deterrent
prove
for
that.
sure. Right.
You could
correct.
never prove the fact that people on Snyder Pond Road slow down. But anecdotally, I hear from people, I think I'd slow down. Because of that.
Yeah.
So you can't ever prove it, but it does. I think it does work.
I will say, I used to do the traffic safety, once a year, they used to do the school bus safety. And I used to ride on the school buses, and inevitably, people were passing stop school buses. You witnessed it every time.
Right.
It wasn't a lot, but it might have been 1 or 2 cars. And that's just one day.
Every
And in one area.
one route.
Well, there's definitely a need for it. So, I mean, the thing is, if you had it and then you publicize it enough, just like with those signs along the road say, slow down, would the fact that people know they could get caught, would that slow people down? Maybe.
Michael?
Yeah, the evidence that I asked for evidence, that what they cited was that they typically see a decrease, like from when the program starts to a year later, they do see a decrease in the amount of tickets, and that people rarely get more than 1 ticket. So I'm not sure if that proves the program works, but those were their
deter that person.
Those were their data points. Is that when the program starts, they issue more tickets than and then a year later, and that you're not getting it's mostly first time offenders,
not repeat offenders.
And because Bus Patrol is doing adjoining counties, although we could do an RFP and see who else, there's other companies out there, it just sort of makes more sense to try to use the same company that our adjoining counties are using, but it's a lot of hand-holding to do this to get this to completion for sure.
I think it's just concerning too, which they presented, Dutchess County wasn't receiving any money as of yet. And, you know, in the beginning is the highest point of when there's picketing, and it's supposed to go down. So if they're not even receiving enough to support them, you know, how much is this gonna cost us? Because we're not gonna be able to support this, and it's gonna cost us.
Well, that I specifically asked them, Ray. I said, because just doing the numbers in my head saying, think about this, they're gonna put cameras in every single bus in every school district, right? The software, the setup, the time. I said, is there enough revenue that comes through from people paying fines to offset your expenses? And he immediately said, well, we have to see. So I said, so there could be a cost to the county. Yes. Does that mean that we couldn't have an MOU with the school districts and say, hey, you know, this is what the cost is, and every school district would have to kick in? Of course, we could look at that as well, but I think I just felt after listening to the whole program, and I understand why people want to do it, and I wish our vehicle and traffic laws were back to the way they used to be, and stricter and more scoff laws and all of that, which that's all changed also. But if there's not a huge mechanism to enforce it, then I have, you know, I realize if it helps somewhat, it's also good, you know, because we have children in buses. But so it was a little bit overwhelming in reference to how much is involved in doing this. So.
But it must work, right, Mike? Because you said it's only one, usually it's only one. The data telling you get one ticket for one person, maybe they say.
I guess I don't know how I don't know if the reality is that most people, it's because say right now before you have bus control and people are passing school buses, but we don't know how often it's the same people passing school buses. So they're just saying that once you put in bus patrol, it's different people passing school buses, but that might already be the reality might already be that it's not repeat offenders who pass buses, it's just random people over time.
It's just, it's not the same one getting tickets over and over.
So I guess the alternative also might be is that we could do a marketing campaign about not passing school buses. That would be a lot easier, right? We could just put aside $5,000 or $10,000 and say, we're going to like do some radio PSAs. We're going to put some Facebook ads out. We're going to put some press releases. We're just going to do a marketing campaign that says don't pass school buses. And we could spend a little bit of money, but it'd be so much easier in terms of labor. And so I think in some ways that's the comparison. So if we want to take action on school buses, we can do a marketing campaign, and presumably the marketing campaign would reduce offenses. And is that enough? Like, so
Right.
I think like, because this isn't the only option that we have to do this, and it is like I came in very skeptical, and I was impressed. Like these guys are organized, they seem really helpful, they seem really professional, and there's no going around it. It's a lot of work.
But it's not costing you anything.
Well,
And
we don't know that.
advertising is gonna cost you.
Well, it's still counting. It's still
10 to
costing your
20,000.
share of stuff. It's still counting.
No,
the
it's
share
gonna
of
cost
stuff.
us because we're gonna have to hire somebody potentially. There's a lot involved. We gotta pay the county attorney to, you know, pass laws. I mean, again, I'm not saying we shouldn't do it, but it's a lot involved. I just want to know if we're all as a group interested in pursuing this, then we'll pursue it. But because if you didn't sit through the presentation, you know, it was heavy because it's a heavy lift. So, but again, if we feel we should pursue it, then we'll pursue it. So.
And then just to clarify, they do go out to the schools, they do go out to the towns, and we'll talk that's what you're contracting with basically, is they will go out and educate everybody. We have to pass a local law. The schools are all on board. Tistria wanted to start in September, right? She's like, let's go September.
Well, when she found out that it wasn't going to happen in a
Right.
month, she actually went off the call,
Well,
not
she
because
lost.
she wanted to, but we were almost like, well, she didn't like that answer.
We're working with the school districts directly. We talk about surveying the bus drivers, and the bus drivers know. They know. I mean,
Sure.
whether the number of cars that reduce their passing.
They didn't bring that point up. Yeah.
Right, to find out.
You were saying that there needs to be an analysis of revenues done. Seems to me that there would need to be two, one for revenues at the beginning of the project and one after a year, because after a year, the revenues go down. At what point would that analysis be done? And could that information be available as part of this discussion,
So if we were to hire them, then they would put a proposal together.
but otherwise, not.
Yeah.
And I would think it would be a multi-year contract. 'Cause
Right.
We're not gonna install all those
Correct.
cameras.
I think he said 5 years.
Yeah.
So they're gonna come back and say, you know, it's gonna cost X, or we, you know, just based on their past history and knowledge with other counties. I just got the sense in talking to him that there would be a cost. I didn't get the sense that there wasn't gonna be a cost, but we don't know what that cost is, honestly. So, I mean, we can ask them for a you know, proposal and see if they'll put together a proposal that we can look at and review.
You can also reach out to the other counties that have been doing it
Yeah.
as well.
I mean, we've talked to Dutchess, maybe it's worth our time talking to Rensselaer.
Rensselaer.
But we're smaller than these other counties, so, you know, it's.
Well, two things that I look at, and I think everybody in this room could say the same thing as me, is traffic has increased. There's more people in Columbia County than there ever has been. And Gene, you're absolutely right. Those signs that we put up, I see when Chatham's got one where it's got trooper lights flash.
It scares the heck out of you.
And guess what? I slow down because I'm, oh God, you know, so you think about it. So this might help the bus situation. People start getting something. You say, oh, I got to control myself, watch what I'm doing. You know? We're not going to get them all, but at least you might get some. So it's worth, I think, looking into.
Our school systems that overlap county lines, they've clearly been approached by Rensselaer and Dutchess, and they're waiting on us. You know, it sounds like it'd be good to hear from, you know, the school systems with the overlaps.
Yeah, the way it was described to me is like, for example, in Dutchess County, they have certain rules in Dutchess with the cameras, but they can't use the camera, those buses can't use the cameras in Columbia because we haven't passed that.
And cameras are becoming standard equipment on buses now.
Some buses already have cameras, so they have to
Most of them
install
are,
their own.
most of them are
Interior.
internal.
Interior.
And they'll also do interior, if you recall, they said, if we want.
Are the school districts reporting back that it's?
Uh,
I mean, it seems like, unless if they're going, how long have they been?
Bus patrol.
Yeah.
They've been around a while. You saw all the counties. I mean,
They should have a good idea.
But the first presentation was from the Dutchess County officials, right?
Mhm.
Asking us
Correct.
to do this.
Yeah.
And they gave us data, but I don't know that I saved it. I don't know if you can find it. They had a slideshow just like this.
I would like
One
to see
area
a proposal.
I think this
If we can get some kind of
Yeah, a
proposal.
proposal, so
If we can get some, so we have some idea what we're looking
All right,
at.
so we'll reach back out to bus control, tell them that we're definitely have some interest. Could you put together a proposal that we could bring back to the committee? And then discuss it when we have real numbers and a real sense of what's involved. I mean, we know what's involved, but I mean, I don't think we have a ton of time to make this decision if you even want to do it next year. I mean, maybe a couple months. If we're not involved in this process, to me, within the next couple of months, it might even be a challenge to have it ready for next September. So that leaves us with August, September, maybe the latest October. But yeah, we can reach out to them and ask them to put together a proposal. Absolutely. They were, I mean, again, they were very nice. They seemed to be very knowledgeable. They didn't seem like there was any, like, anything they were hiding. They were completely open and honest about.
And they're
the whole
very busy.
process.
Like,
Yeah.
right? Like he, you know, he had a lot of presentations and they're like really busy. Because what were they installing? 13,000 cameras or
something like that.
something like that. In the process of, so.
So we'll ask them for a proposal and we'll bring it back next month.
Are you gonna have him propose like virtually or what do you?
No.
We'll just ask them to put together something here with
That
some,
is our proposal. I mean, that's our.
does this have costs in it though?
But, there is no cost is what they're saying.
But that's not what he said. He said that once they got involved, they would have to do a much more involved, detailed, look at the county and then come back with, because when I asked him that, he said.
Right,
we
they have to answer our.
Right, yeah. So we can ask that question.
I think we had talked about them providing us with that RFP.
They did, and I sent them out. Yeah. Yeah. There was 2 of them attached to that.
So is this about cost or is this about, let's just assume they come back and say, we'll do it for free. Is the group interested and inclined to move forward with it?
If they do it for free.
I know, absolutely.
Well,
Absolutely,
it's,
come on.
but it's still not gonna be free.
It's not
for
free. I
us.
mean, we still have, yeah.
Because we're gonna have to have
It's
staff.
public safety. I mean, I think that one's not cheap. I mean, unless it's an extravagant number, I think we really should do.
I think if something does go wrong, There is
Yeah,
an
right.
exit
Split,
memo
it was
being
saved,
sent.
it was saved one
Well,
kid.
Could have done it, right.
Any amount of
That's what I'm
money
saying.
spent.
One time.
No, I'm fine with it. And I do think that the only thing that made it a little more palatable was the fact that they were very clear in saying that we will walk you through the whole process. We'll take it all on and do it all. So, you know, they'll reach out to DOT, they'll reach out to the county, they'll reach out to the school districts, they'll do all of it, they say. So why don't we get a proposal? We'll get what their thoughts are on it, and then we can make a decision next month.
I think the other due diligence is the other, just checking with the other parts, like the sheriff's office, the DA's office. I'm not sure if there was like somebody that we can like represents the judges, but like it seemed like there were a lot of pieces that it only works if people that are beyond the board participate. Not only do we need their cooperation, we also maybe need their staffing. So I think that's.
So we'd have to reach out to the DA for sure, the sheriff for sure,
Magistrates Association.
maybe the Magistrates Association of Columbia County. That's a good point. And then, you know, as far as DOT and all the others, I'm not really that concerned with that stuff. So, yeah, we can do that before next month also.
Great.
All right.
Good.
Anything else? Any questions from the public? Motion to adjourn?
So moved.
Second?
Second.
All in favor? Aye. Opposed?
Ready?
Carried.